Miss Katie. I'm really excited to be here with you this afternoon talking about my very favorite topic in adult education. I'm a consultant with American Institutes for Research. I just moved to California in July. Before that, I spent the last 10 years managing an adult education program for a large nonprofit in Chicago. And I have experience teaching ESL, HSC, and IET, and health literacy is definitely my favorite content area to embed into all of those classes. So our agenda for the day, I'm going to start with a quick warm-up question and then dive in, and we'll talk about what health literacy is and why it's important. And then we'll cover some skills that are really important to emphasize with your students when you're covering health literacy, best practices for teaching health literacy, and then we'll take a few minutes in the middle to break for questions if you have any questions about the first half of the webinar. And then we're going to go into a case study, and I'm going to talk to you about how I embedded these skills and best practices into my program in Chicago. We'll spend a minute to talk about the importance of health literacy specific to this time right now during the pandemic. And then I'll review some specific lesson plan ideas that you could take away today and use in your classroom, and some specific resources. And then, of course, some more questions at the end. So I was wondering how often y'all are currently embedding health literacy into your classes, if it's never, sometimes, or often. See lots of respondents. Looks like a few for never, but most of you are saying sometimes. About 70% of you are saying you sometimes teach health literacy, which is great. 16% often and 10% never. Okay, good mix. And I was curious if you're currently teaching health literacy. So if you are someone who's answered that you're sometimes teaching it or often teaching it, what kind of topics are you working into your curriculum? If you just want to throw it in the chat, I'm very curious to see what y'all are already teaching. Let's see, we've got, emotional health, really important, accessing healthcare, healthy foods, first aid, telemedicine, locating low-cost health clinics, that's great, so important. More emotional health, COVID measures, talking to a doctor, diabetes, stress management, again, healthy food, visits to the doctor's office, talking about emergencies, lots of workplace safety, that's great. That's, then you're hitting workforce preparation and health literacy, which is so great. Self-care, lots of talking to a doctor. Of course, that is so crucial especially when you have ELLs. More COVID measures, social emotional well-being. Great, healthy food, healthy lifestyle. All right, y'all are in good shape. You're already experts. Okay, so let's dive in. So what is health literacy? Health literacy is the ability to read, understand, evaluate, communicate, and act on health information and access healthcare services. And the U.S. Department of Health and Human Services defines health literacy as the degree to which individuals have the capacity to obtain, process, and understand basic health information. And why is it important? So critical health literacy empowers adult learners to improve health for themselves, their families, and their communities. Many low literacy adults avoid seeking health care until they find themselves in emergencies, which results in higher rates of hospitalization. Many adult learners must also manage the health of others, such as young children or older parents, in addition to their own. And adult learners make health-related decisions every day that draw upon their experience and knowledge of how to keep families healthy and what to do when a family member is sick, as well as how to access and use health information and healthcare services. So promoting students' health literacy skills can help them make these decisions more effectively. And health literacy is immediately applicable to all of our students, especially English language learners, and it can really provide an authentic content area for teaching really any area. So research shows that students with limited education and literacy skills have more health problems, less access to available healthcare services, greater difficulty understanding health information, and higher rates of hospitalization. In addition, those who don't speak English as their first language and are unfamiliar with the culture of the United States face increased barriers. The literacy skills required to navigate the US healthcare system are really immense, and that's why it makes these skills to communicate clearly with healthcare providers and ask clarifying questions even more important. And also, intersectionality must be recognized and addressed. So barriers exist at the intersection of literacy, language, culture, economics, and more. And as mentioned, healthcare issues disproportionately impact English language learners. And as we've seen with COVID, healthcare issues disproportionately affect different racial communities as well. So really incorporating health literacy in your classroom is a great step towards having more equity in our society. So that was a quick overview, and now I want to spend some time to talk about some important skills that are necessary to embed in your classroom to really strengthen your students' ability to navigate the healthcare system. So the first is critical thinking. And critical thinking involves being open-minded and rational, and it's informed by evidence and helps users arrive at decisions or conclusions that go beyond factual recall. In adult education classrooms, critical thinking skills involve actively applying thinking strategies that range from analyzing relationships to drawing conclusions from a variety of data. So within health literacy, students have to have this skill in order to recognize their barriers to health. So one way to embed this skill into your classroom is to have groups of students analyze data they've collected around a health topic, for example, exercise, and then they can create graphs and present findings and summarize barriers to that behavior. The next skill is communication. So adults with strong communication skills can convey information to others effectively and efficiently. They can do so verbally, non-verbally, and in writing, and they can repair communication breakdowns when they occur and adjust their communication style. So within health literacy, this skill is so crucial. As a lot of you mentioned in the chat, you have been teaching your students how to talk to doctors. And students need to have this skill because it's necessary to communicate health information with a variety of people. So one example of a classroom activity would be to have learners work in small groups to develop a poster on a topic of their choice related to health. For example, hand washing. Another example would be to have them practice writing an email to their child's school if their child is sick and will be missing class. The next skill is processing and analyzing information. And processing and analyzing information requires an analytical thought process. It's a methodical step-by-step approach to thinking that makes it possible to break down complex problems into manageable components. So in processing and analyzing information, adult learners first have to identify a problem, then gather the information they need to develop a solution, and then apply the solution. So within health literacy, this is really crucial. Students must have this skill because that's how they can evaluate the accuracy and reliability of health information, both in the news and on the internet, or even from their friends. So one example of a classroom activity to reinforce this skill would be to have learners fill out a handout that guides them to compare and contrast information found on 2 different websites. And then they can determine which of the 2 websites they trust more and then explain to the class what the reasoning is for choosing that website. The next skill is self-awareness. And self-awareness is the ability to take stock of one's own emotions, thoughts, and values, and then recognize their impact. It's the ability to accurately assess one's strengths and limitations, but while maintaining a growth mindset. So within health literacy, again, it's such a crucial skill. The students must have this in order to recognize the culture of healthcare in the United States and respect differences in diversity. So one example of a classroom activity to reinforce this skill would be to have the learners watch video clips describing what healthcare is like in different countries, and then share what differences they see with what they've noticed in the United States. And if it's relevant, if you have ELLs, what their experience was in their home country. And the next skill is problem solving. And problem solving is a part of everything in adult daily life. In the classroom, it can really take the form of reading or listening to a problem scenario and then having the students brainstorm solutions. And then they can create a pro and con list for the solution and then apply the solution in the classroom. That could be in writing or in a presentation. And within health literacy, students must have this skill to differentiate healthcare needs and be adaptable to different healthcare situations. So one classroom activity, and I see a note, will be able to get a list of these activities. Yes, I will provide everything at the end. So one way to reinforce this in the classroom would be to have learners choose a specific illness they want to focus on, and then they could use the internet or provided resources to investigate what can be done to prevent the illness and what the treatment should be. And then they can create kind of cheat sheets or brochures and share them either with the class or within the school. And the last skill I want to mention is navigating systems. This is the ability to successfully operate within the institutions and organizational structures that are a part of communities, workplaces, schools, and families. And within health literacy, this is so important because students must have the skills necessary to access the US healthcare system. And as we all know from our own experiences, it's very complicated. So this skill of navigating systems is extremely crucial. So another classroom activity to reinforce navigating systems could be to have learners listen or read a scenario about someone who has a child who's suddenly become ill, and then have them respond to questions about what actions they should take. These sample scenarios are really helpful in health literacy because it enables you to talk about some sensitive subjects without having the students share their own experiences. So it does allow you to get in a little bit deeper. And now I want to talk about some of the best practices when you're starting to embed health literacy into your classroom. These are 5 best practices that I have pulled from a project that AAR completed for Octave. It's called the Teaching Skills That Matter. They have 5 content areas that they focused on for this project, and one of them is health literacy. All of the materials are accessible on links, and they're all free, and they are really fantastic. They have best practices, they have free resources, they have lesson plans, they have case studies. It's really a fantastic resource, and I will be providing that link closer to the end of the webinar. So the first best practice is to create a supportive learning environment. You don't have to be a health educator to effectively integrate health literacy skills into your classroom. I know it sometimes is intimidating, but it's certainly not necessary to be a healthcare professional to teach healthcare and health literacy. So your goal is to create a learning environment that teaches the skills that matter in order to help adult learners find, understand, evaluate, and use health information for themselves and their families. So in order to make sure students feel comfortable with these topics, health literacy issues should be approached in a trauma-informed way and with a culturally competent lens. And this, of course, is generally a best practice with any topic in adult education. And I'll go into a little more depth about that when we talk about how I implemented this in my program. And then another great way to create a supportive learning environment and a comfortable learning environment is what I mentioned a moment ago, which is to use example scenarios so that the students aren't having to share their own healthcare stories, which may be too sensitive. So the second best practice is to draw on learner health beliefs, experiences, and knowledge. So students sometimes learn best from one another, and a learning environment in which students' contributions are valued will make them eager to share what they know and think and to value each other's ideas. It also helps them learn to evaluate new information. So one topic that I find is always a big hit in class is to talk about home remedies. And this is a great way to get the students involved and bring in their own experiences and background knowledge, whether it's just home remedies that have been passed down through their family in the United States, or if they have home remedies from their home countries. That's always a really popular topic with students. For example, if you have ELLs who are healthcare workers in their home countries, they may be able to really contribute when you're going over health literacy topics. And best practice number 3 is to collaborate with local health organizations. So working with a local health organization provides opportunities for real life experiences such as field trips. And these connections really improve students' knowledge about the available services, and they also build their confidence to make them feel like they could access those services independently. It's just a really great way to make students feel more comfortable accessing these services on their own for themselves or for their families, because if they've seen it with the help of their teacher, they may be able to do it independently at a later date when it's necessary. And I know from seeing what y'all have been teaching so far, some of you are already doing that, which is so fantastic. And the best practice number 4 is if you are going to work with other healthcare organizations, to prepare the health professionals before they speak in your class. Many health professionals and even health educators aren't prepared to present information in a way for adult learners to really fully understand the material. So it's good to present them with tips, either in how to phrase their wording or to use visual aids, or how to break up the information so it's more digestible. This is definitely a really necessary step if you have a guest speaker or if you go on a field trip. Luckily, I do think in a lot of cases, healthcare workers are already pretty experienced in working with patients who don't speak English, or even if they're working with American patients who are native speakers, they're just kind of used to translating the medicalese and for lay folks. So they do need some preparation, but they also certainly get some experience in that in their daily lives. And best practice number 5 is to have students share what they learn with others. The act of presenting healthcare information to each other can encourage the students to share what they've learned with their family and friends, so they're spreading the health literacy. It also reinforces what they've learned. So for example, in your own class, you could have the students individually research and present about health-related topics in front of their class. You could have them, your class work in groups and then present to other classes. You could have them set up an information booth in the school. You could have them create info sheets on a health topic and take it home to share with their families. These are all great ways to ensure that the students are practicing what they're learning. Of course, with health literacy, we do want to fact check things before they pass along the information. And lastly, this is not necessarily a best practice per se, but I did want to note integrated and contextualized learning as an effective approach for embedding health literacy into your classroom. So in planning integrated and contextualized instruction, the focus is on using relevant content areas as the context for your instruction. The contextualized lesson builds content knowledge while simultaneously integrating instruction in reading, writing, math, language, and soft skills. And the research suggests that this really accelerates the learning process. So there is a way to marry the content that your students are already expecting from you in your specific class along with health literacy. So you can use integrated and contextualized approach to weave health literacy into your normal curriculum. And just a few examples, again, we'll get a little deeper into the examples later on, but if you're teaching ESL, I think health literacy is a great vehicle for teaching modals. For example, if you're talking about healthy habits, you should exercise, you should not smoke. It's just a great way to reinforce that grammar. If you're teaching math, you could do a lesson on the cost of health insurance. If you're teaching a workforce class, you could do a lesson about understanding the healthcare benefits that may be offered by employers. So there's lots of ways to integrate health literacy into any classroom, any level, any topic. So we have a few minutes here for questions. If anyone has I know that was a lot of material, so that's why I wanted to pause in case anyone had any questions before we go into how I embedded the skills and the best practices into my program. Feel free to pop them in the chat. I will implement my teacher pause here while y'all are thinking if you have any questions, and if not, we can move along. Let's see. Yep, we're going to be moving from theory to practice. We're going to get into the nitty-gritty application. Are you available to visit a class via a Zoom meeting? I'm not sure. An adult ed class? This is like showing the Sure. I'm always happy to teach health literacy. As I said, it's my very favorite content area. Okay, so I'm gonna move along. I'll listen to Cecilia and we'll get into some practice here. Okay. So as I mentioned, I want to talk about as a case study, how I implemented all of these skills and best practices into my program in Chicago. So for context, I was working at a large nonprofit. It was one of the 4 refugee resettlement agencies in Chicago. My program served about 1,200 refugees and immigrants a year through ESL classes, HSE classes, and IET classes. And I taught all of them, and I brought health literacy into all of them. So in my program, every year we always decided on some health literacy topics that we wanted to make sure we were bringing to our students, either through classes or in their cultural orientations, because as I mentioned, it was a resettlement agency, so they did have weekly cultural orientations. And then in the 2019-2020 academic year, we decided we really wanted to have the students participate in that process. So we decided to survey the students and find out what health literacy topics they wanted to cover throughout the year. So we surveyed all 1,200 students and compiled the results, and we picked the top 12, and we chose one topic per week of the quarter, and really tried to think about how could we approach each of these topics that the students chose in a culturally competent way and in a trauma-informed way. And that really got the ball rolling with best practice number 1, which is creating a supportive learning environment. And it also reinforced the skill of self-awareness, because the students had to think about what do they want, what do they need information about, and what do they want to be taught, and then they asked for it, and then they were supported because we then followed through with providing instruction in all the topics that they had chosen. So once we knew what topics we wanted to cover, we had 12 topics that we needed to cover in a semester. We decided to work as an instructional team instead of individually. As as I mentioned before, sometimes it can feel intimidating to approach health literacy topics if you are not a healthcare professional. So we thought it would be best to use our collective brains to attack this list of topics. So some teachers were more knowledgeable in certain areas than others, and some felt like they could create lesson plans, and some had ideas for workshops. So it was really great to come together to make sure that we were addressing all of these requested topics versus feeling like we had to address them all individually. So let's take a look at the topics that my students chose. So from the 1,200 students we surveyed, these were the top 12 topics. And you can see some of them are very specific and some of them are pretty broad. Also, some of them are quite sensitive and some of them are not. So we really had to think about ways to approach each of these that were specific to the topic, whether it be a very narrow approach or a broad approach, and whether it needed to be approached with kid gloves or we could just dive in. So that's another reason why it was really helpful for us to work on this as an instructional team versus going it alone. So you see the topics here: diabetes, mental health, talking to a doctor, heart health, the immune system, nutrition, stress management, domestic violence, cancer screenings, reproductive health, food safety, and visiting a clinic. And I have to say about half of these I was expecting from the students and half I was very surprised by. So it really was an interesting exercise to have the student input. So as I mentioned, each topic really needed a different approach. So for these three topics, heart health, stress management, and cancer screenings, we did create leveled lesson plans. So we did have teachers who were comfortable in these areas and decided that they would write a lesson plan and then kind of a general lesson plan, and then all of the teachers would adapt it for their specific levels. So it was sort of aimed at intermediate ESL, but then like a beginning ESL teacher could adapt it for their students, and then an ABE ASC teacher could adapt it for their students. So for heart health, we did have a lesson plan that was adapted for all the different levels. The lower level ESL plan had a lot of vocabulary as supports because they needed to learn a lot more words before they were able to really dive into the content. And then we adapted it all the way up to the ASC lesson plan that was more math focused, and the students were completing some math problems about calculating heart rates. And it was really great. This level 1 students really enjoyed this adapted heart health lesson plan, and we actually had a former internationally ranked bodybuilder from Belarus who was in the level 1 class, and he volunteered to teach an aerobics class to all the students just as a supplemental class after their regular morning class. So he would stay after once a week and lead an aerobics class for our students in Russian, and one of our teachers, who was a native Russian speaker, would translate all of the instructions into English. And so that was great. It was very popular with our students, and it was a great way to bring in that best practice number 2, drawing on learner health beliefs, experiences, and knowledge. We also did the same for stress management. So one teacher created a fairly general lesson plan, and then all the individual teachers were able to adapt that lesson plan for their specific level that they were teaching. And that was really great. And then for cancer screenings, again, we had the general lesson plan that then the teachers adapt for their specific levels. But we did ask for the higher level students we made this into a digital literacy lesson. So they did all the research online, and then they created a fact sheet about who needs what cancer screenings at what age and at what intervals, and how to go about doing that. And so they worked together as one class to create this fact sheet, and then I had it checked by a subject matter expert in the field of oncology, and then they distributed it amongst our schools. So that was the way that we decided to embed Best practice number 5, having the students share what they learned with others. It was also a great way to reinforce that skill of processing and analyzing information as well as communication, because they had to find all of that information on the internet, but then process it and put it into this format that we were asking for, and then communicate it to other students. And this was particularly great because this group wanted to take it further. They realized that the students in the school needed this information. So the assignment was to do it in English because it was an advanced ESL class, but they actually translated it. All the students that spoke different languages in the class translated it into their native languages so that the lower level students could get the content from their fact sheet. Okay, and then for the immune system, nutrition, and reproductive health, we decided we would address these as workshops. So for the immune system, we created a fair in the class. We planned multiple booths all around the school with hands-on activities that illustrated ways to keep your immune system strong. And some of the booths were led by teachers, and some were led by nutritionists that we asked to come in and guest star in our fair. And then we actually had some students who had their own booths who had certain expertise from their home countries. And then the teachers had given all of the students worksheets to fill out as they walked their way through the booths. And those worksheets were made by each teacher for their specific level. So the worksheets corresponded with whether it was a beginning ESL class or an HSE class. And that was a really big hit. So we just did that during the regular class time. So instead of attending the regular class, they all came to this common area to attend this fair and complete the worksheets that their teachers had given them. And that was a huge hit. The students really loved it. So we did it again a few months later for nutrition. So we did one with the immune system and then a second one with nutrition. We just edited the focus. And then, so yeah, this was a great way to, again, reinforce best practice number 5, where they're sharing their own knowledge. And again, reinforcing processing and analyzing information and communication skills. And then for reproductive rights, we knew this was going to be a really sensitive topic. It was requested overwhelmingly by the students, and we weren't sure how to address it. And we also knew that it was not necessarily a topic that should be a vehicle for learning math or grammar, but just an area where students really needed the information. So instead of having this during class time, we did schedule it after class. So it was an optional workshop for students. They were welcome to just leave but after their regularly scheduled class and not attend this. But overwhelmingly, most of the students stayed. Only the ones who needed to work left after their regular class. We had them select their rooms. They were divided by gender. And then we brought in clinicians from a refugee health organization, and we also brought in translators because we needed really experienced, thoughtful guest speakers to talk about these topics. So we were very nervous about it, but it went very well. It was definitely information that the students needed and were eager for. And the trick was really just finding the right guest speaker. So you can kind of see this range where the immune system is very easy to approach with students. It's not a sensitive issue, but all the way to reproductive health, where we were talking about a very sensitive issue. So we really didn't want to shy away from anything that the students requested, even if it was tricky to address. And then for the topics of diabetes, mental health, talking to a doctor, and food safety, we brought in guest speakers. And this is where we needed to use best practice number 4, preparing health professionals before they speak to your class. So most of us at my agency were ESL teachers. So we were very nervous for any guest speakers to come in and talk to our classes because we were concerned they wouldn't speak in an accessible way for our students. But again, overall, we found that all of the guest speakers we brought in as healthcare workers in Chicago, they were already pretty well versed in speaking with ELLs. And even if they were speaking with native English speakers, they were already really good at presenting medicalese in an understandable way. For mental health, we did get a specific guest speaker who had experience working with refugees and was therefore familiar with presenting material in a trauma-informed way. And she was also able to provide the students with a lot of resources and referrals. This was the other big piece we wanted to make sure we were covering, that we didn't want to just give them the information and have that be the end of the lesson. We wanted to make sure that we could follow up any questions with really concrete referrals and references, and also that the referrals wouldn't just be a phone number, it would be, we would have a way to give a soft handoff for that referral. So it took a lot of pre-planning and anticipating what students' needs would be as far as referrals and as far as answering questions. For talking with a doctor, we started again with a lesson plan that one teacher wrote and then all the other teachers adapted for their classes. And using that lesson plan, we prepped and we practiced with the students on how to speak with a medical professional. And then we brought in nurses as guest speakers. So it was kind of like if you do mock interviews in workforce prep, but it was like mock talking to a doctor. So we had real nurses come in and do like round robin interviews with the students after they had finished their lesson plan where they had prepared with their teachers. And then for food safety, this one was a little bit of an undertaking. This took actually almost an entire week, but we brought in a chef who was our guest star, and he went through the Serve Safe curriculum, and I think we use it in Illinois, but I believe y'all use it in California as well. It's required for anyone who works in restaurants. So he went through the whole Serve Safe curriculum, which covers everything about food safety, which is just fantastic for anyone who eats food. But it was also really helpful for students who were looking for jobs either in the food industry or in childcare because they needed that Serve Safe certification. And lastly, for a field trip, we only did one. We did visit a clinic and it was very handy. It was only a block down the road, so we were able to just walk there. We didn't need to organize transportation, which makes it a lot easier. So during the last week of class, we took a field trip to the clinic, and it was a really good way to incorporate best practice number 3, collaborating with local health organizations. And we were able to reinforce that skill of navigating systems. Unfortunately, field trips are not really possible right now, but hopefully soon we'll be able to resume them. And in the meantime, you can do virtual field trips, and we're going to talk about that in just a minute when I go through some example lesson plans. And just to note, of course, health literacy is even more crucial right now. It's very important that we're teaching students how to dispel misinformation, and we're helping students figure out where they can turn for reliable information. In a minute, I'll show you a lesson plan that helps teach students how to evaluate the information that they're looking at on the internet, because the students need to know how to find accurate information about COVID and testing and now vaccines. In addition to just talking about COVID itself during the pandemic, health literacy is also more important because due to people spending more time at home, added stressors of children being homeschooled, people losing their jobs, it's a very difficult time for everyone for multiple reasons. So it makes it all the more important that we're reiterating health literacy in the classroom in terms of stress management, mental health, and even domestic violence. And I'm going to walk really quickly through a few lesson plans. I'm just going to introduce them to you, and if they strike your interest, I'm going to put the link in the chat for the Teaching Skills That Matter health literacy section of links. All the lesson plans are there. They are beautifully written out. They have all the instructions and all the materials. So they are there for you to explore in more depth. The first is health information in the internet. So this is the one that I was mentioning that helps students learn how to evaluate websites to make sure that they're getting accurate and reliable information. And this lesson plan is great because it has a template for a checklist so students can see if they're looking at an accurate website. The checklist it's written in very clear language and would be very simple to adapt for either a beginning, maybe not beginning, but low intermediate ESL class or an HSE class. So you could definitely scale it up or scale it down. And the lesson is definitely practicing critical thinking, navigating systems, and communication. Another lesson plan that is on that site is called What is Good Health? And in this lesson, students share what they already know about good health. So this is reinforcing that best practice of sharing their existing background knowledge. And then they're processing and analyzing written and oral information on relevant health topics. I love this lesson plan, again, because it's very adaptable. It's all about what the learners already know. So you can definitely adapt it for a beginning or low intermediate ESL class all the way up to HSE because it's so learner driven. It's also very easy to embed any grammar point that you're currently discussing in class or to find a way to embed some math if you're doing HSE. So I just think it's a fantastic starting place to adapt for your specific class. And as I mentioned, if you're teaching ESL, this is a great lesson plan for teaching modals, even if you're only teaching should or if you're teaching all of the modals. This lesson plan is great to look at if you are thinking about doing a field trip to a clinic or a hospital or a healthcare facility. It really walks you through a great way to approach a field trip. And as I touched on before, we can't really do physical field trips right now, but you can do virtual field trips to clinics. I know Ronald Reagan UCLA Medical Center is doing virtual tours online, and you could also ask a guest speaker from a clinic to remotely walk you through a clinic. So there are ways around it, although not ideal, but you could do it in a remote environment. And this lesson plan is communicating with a doctor. And this is a lesson in which students process and analyze information to identify barriers people face when they're accessing healthcare and navigating the US healthcare system. So I did this lesson plan with my class, and it's great because it starts with a sample scenario, as I mentioned, which is a great way to create a supportive environment in a health literacy classroom. Where students aren't having to share personal information, but then they were able to practice communicating with the doctor based on the sample scenario. So this is what I used with my class before we had the nurses come in and do the round robin mock interview style practice. And lastly, this is one of my very favorites, is a lesson plan on the cost of smoking. Again, I just like any lesson plan that can be adapted. I was always rotating through various levels of adult ed classes. So I did this with a low intermediate ESL class the first time, and it's written in such a very clear way. I didn't need to adapt it very much. There were a few words that I changed, and I did a little bit of vocabulary practice to prep them before we did this lesson. But it was so great because we were practicing English, we were getting in some basic math skills, we were getting in financial literacy, and we were getting in health literacy. So I just really love this lesson plan. It calculates how much smoking costs over time, and then the students are asked to talk about what they would do with the money they would save if they stopped smoking. And my students expanded that. Even though they were a low intermediate class, they started talking about, okay, so maybe we could figure out how much money I would save if I stopped drinking soda and just switched to water. So it was just really great how they expanded the lesson for themselves. And I think, I don't know if I had a unique program or not, but my students were always so involved with our lesson plans, and the students that I taught this lesson to ended up, there were a few of them that were smokers, and they started a smoking cessation group, and they would meet once a week before our evening class for 30 minutes just to check in with each other and try to offer support and see how one another were doing with their process of quitting smoking. So I thought that was really cool. That was really like health literacy in action. Um, let's see. So Marcella's going to put the link to links in the chat for you, so you'll have all of those lesson plans. And you'll also have the best practices there, and the best practices all have those example classroom activities that I went through at the beginning very quickly because there's so much to cover, but it's all there for you to peruse at your leisure. So I'm curious in the chat if you have any different thoughts about what you might want to teach in health literacy now that we've gone through all of this material. If maybe there's something specific from the presentation that you think you would like to teach, or maybe there's something I didn't mention at all, but it popped in your brain and you thought, this is a fantastic idea, I must teach it. If you want to throw that in the chat, I'm so curious to see what you're thinking about teaching. Nutrition. Ooh, okay. Maybe talking about stress management, another stress management, mental health, stress management, feeling a lot of stress. Okay. This seems to be a theme during this pandemic. It's definitely really important, as I mentioned before, to be talking about stress management, mental health, nutrition. Yeah, the idea of guest speakers in a COVID-free environment. Yeah, we're all getting so creative, and the teachers in general are being so innovative about ways to figure out how to adapt everything to remote. It's just so impressive, and we can definitely still have guest speakers and field trips in a remote environment. In some ways, it's easier. You don't have to think about, do I need a bus for my students? We can just all virtually go through UCLA Medical Center. Okay. Fantastic. I could read your ideas all day, but I do want to take a few minutes for questions. I did see a couple up here.
I pulled them out for you, Katie, if that makes it easier. One of them was, what was the time frame to prepare lessons, get everything organized, and how long was this taught for? I think that was back when you were describing
surveying my students. We surveyed the students. So we had a quarter system, and each quarter was 12 weeks. So at the end of a quarter, we surveyed the students about the following quarter, which of course isn't perfect because we didn't have the newly registered students participating in that. But we needed the break between the quarters to prepare. So we had a 2-week break between the quarters, and that's when we were meeting regularly to plan everything. We did front load the things that were easier. So if it was something that we were like, yes, we've got it, we know what we want to do, we did that earlier in the session, and then that bought us some time to work on the trickier things. So we kind of had 2 weeks, but we also kind of had 14 weeks. And it was an open-ended survey. We did, all the teachers, when they gave out the surveys, they gave examples because we didn't want to just give like give the students a piece of paper and ask them to write it. They did name some examples, which we thought about for a long time because we didn't want to put ideas in their head and then have everyone write our examples. But we did give them a few, and then we did let them write in their native language just because we didn't want them to feel restricted to what they could say in English. So then, of course, then we had to find people who could read all of those languages. But so it was definitely a process, but it was really, really worth it.
Sorry, I
Go
didn't mean to
ahead.
interrupt. We also got some questions. A couple of people asked about how you addressed domestic violence. And then there was also a question about referring specifically to reproduction, but that might have implications for something else when you have a lot of students whose religious backgrounds were a little different and maybe had implications for the topic.
Mhm.
So whichever
Really
one of
good,
those you want to address first.
really good questions, all things that we had to think long and hard about. As far as talking about reproductive issues, as I mentioned, we did have someone who was a refugee specialized health clinician come in, and we had one male and one female so that we could address the separate groups. And they really tried to, I remember they said, we don't want to editorialize. So they really tried to keep it just like presenting facts on the board, which is normally not, we want to be more learner centered, but that was just like a presentation of facts. And then they had, as I mentioned, additional resources and referrals. We wanted to make sure we had things immediately for the students if they had a question afterwards. So we were prepared for individual situations after the fact. But yeah, the students, it was just much calmer than I was anticipating. The students really didn't mention anything. They just listened to the clinician present. And maybe that's a benefit to having a guest speaker versus a teacher, because I know if I presented that as their teacher that they are comfortable with, they would have been saying teacher, 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 teacher. But because it was a guest speaker, they were on their best student behavior. And domestic violence, I did skip over and I forgot to mention it. That was another one that was very tricky. And we actually decided to address this both because the students had requested it, but we had had several instances involving police in our agency with issues with students. So we knew it was something that the students were experiencing. I decided to teach that myself versus having someone come in. And I didn't explicitly talk about domestic violence. I talked about general family law in the United States. So I tried to make it like a legal cultural orientation for the US. And we talked about a lot of things like how old your children need to be before they're allowed to walk themselves to school or be left home alone. So we talked about a lot of these general family law issues, and I just presented them as laws that we have in the United States. And then we made sure that there was a lot of material around the school, but for the students to take, but like in private places. So we made sure before I taught that lesson that there were tear away flyers in the bathroom stalls. So they had like hotlines to call in various languages. So we didn't want to just like give them the information and then finish. I could talk about this longer, but I know we're short on time. I have quite a few resources here I wanted to share with y'all, but we'll put the links in the chat now. There's one here. This is a reading exercise, and this one is a writing exercise. This is a toolkit. This is another toolkit, and this is another great toolkit. They're all really great resources that are available for teaching health literacy, and we'll put those in. Marcella, are they in? Oh, here we go. Vicky's putting them in. Fantastic. So they're all there for you. And a great book series that are good for lower level ESL classes. And I know it was a lot of information for an hour, but I hope you were able to pull some useful activities. And yeah, thank you for attending today. We will be emailing an evaluation link later.
Please look for that link in the thank you for attending email that you always receive from Vicki when you participate in these sessions. And we encourage you to fill that out because that always gives us information on how to improve. We're always looking to serve you better. I do encourage you to check out the Teaching Skills That Matter TSTM toolkit that Katie mentioned. It has some great lessons in there that you can pick up and use in your classroom tomorrow. You'll probably have to adapt it a bit based on your lessons. But anyway, they're great. So with that, Katie, thank you so much for an incredible session. It was great to hear about how you taught health literacy and integrated it into your classroom, met your students' needs. I will, hold on, I can put into the chat one more time the link to that toolkit so that you do have that.
And I'm sorry I didn't get to everyone's questions in full. I did pop my email address in there in case you have any questions. All right, thanks everyone.
All right.
Have a good afternoon.
Bye.
I'll go ahead and close out.